In Medicare and Money, there is a way to make cost-effective decisions if you're setting up a Medicare plan for yourself. Here's Bob O'Connor, the vice president at Aetna Medicare, a CVS Health company, here to help us. And what do we need to know? What's new this year?
The annual enrollment period goes from October 15th to December 7th, which sounds like people have a while, but in reality it comes really quick, especially because it comes on top of holidays like Thanksgiving. And so there's a number of things that people should look at every single year when they're thinking about these benefits. Looking at your monthly budget, making sure that you can afford the premium and the copays, checking out the drug list that the plan has. Are your medications on the plan and what does it cost? A lot of times those drug copays will change year over year. At Aetna, we actually took nearly 300 drugs and dropped them from a higher copay, $45, maybe even $100 down to $0 or $5 or $7, depending on the situation. And so a huge savings for people. And so keeping on top of that, and then making sure that your providers are in the network, your doctor, your hospital, are they in the network, and making sure what they would cost when you go to see them. And then probably the thing that's really changed these last couple of years is that there are so many extra supplemental benefits, things that are probably in people's budgets right now, which now can be covered by your health plan.
What are some other ways that people can save money?
There definitely is. I think the biggest thing is a lot of the new extra benefits. And so, more recently, a lot of companies have added coverage for dental, for eyewear, for hearing aids. As we all age, we all need some of those things more and more. But we've also added things like coverage for over-the-counter medications. And so these are things that people are paying for right now. And inflation, right? It keeps on making everything cost more. And so, we've added some extra benefits like healthy food cards and other cards that will help cover some of the other costs that somebody might have, helps fill in the gaps that folks have in their monthly budget.
Any final tips?
Yeah, absolutely. So, we think it's important that people take a look at their coverage. I was talking to an agent just the other day, and, it was a middle-class couple, and they hadn't looked at their benefits in a long time. And so they were really on a program that had a higher premium, maybe a couple $100 each a month. It had benefits that weren't so great. Between the extra things that were going to be covered and the savings in premium, between the two of them, they were saving nearly $1,000 per month. And so I think the biggest thing, Angie, is that people give themselves a financial checkup with their healthcare, not just a medical one every single year. And I think also accessing the resources that are out there. Lots of good information that the government provides at Medicare.gov. Lots of ways to compare plans. And also we've got some resources online at Medicare.com. And so we ask everybody to check us out. We think you owe it to take a look at it. And, and like I said, get at it fast, because, we every year get calls from people in late December wanting to change their coverage, but they might already be, locked into next year's plan. And so it's important that people check it out and make sure they're getting everything that they're entitled to.
Thanks so much for helping us out with Medicare and Money today.
Absolutely. Thank you.
Go to businessfirstam.com for where to see our show on TV.